Hello, everyone, and welcome to the second workshop in a 5-workshop series on leadership development titled Tell Me More About That, How Being Curious Makes You a Leader. In today's workshop, from Harris Consulting will talk to us about how to develop from a manager into a leader. This is a workshop, so we would love your participation. We also hope to give you an opportunity to connect with other RHC leaders across the state. Once the workshop series is complete, there will be an opportunity to schedule a one-on-one coaching session with Lauren to ensure you take actions on the next steps. If you are interested in scheduling a coaching session, send me an email and I will send you the details and make sure you get scheduled. Lauren is passionate about medical practices and enjoys partnering with them to see them succeed. After years of honing her skills within large and small organizations of multiple specialties, including an RHC and school-based health center, she started her own consulting practice in July of 2020. She partners directly with practitioners and leaders to provide business and operation expertise. Lauren started her healthcare management career in 1992 and achieved her MGMA CMPE certification in 2008 and her FACMPE certification in 2013. Before we begin, I have a few housekeeping details. This workshop webinar will be recorded. Eric Jordan will post the slides and recording on the Office of Rural Health website within the next few days. Thank you to Eric, who is our tech support during the workshop. If you encounter technology problems, enter your question into the chat box and he will assist you. You are all currently muted and can unmute yourself to speak. You can also enter your questions into the chat box. Your video camera can remain on or off. That's up to you. Lauren will be happy to answer questions at any time and welcomes your comments. There is a link to a survey in the chat box. Please complete that before you leave today. I will put it in again. I put it in earlier, but I will put it in again. Please enter your name and the city you're from in the chat box as well. And without further ado, please welcome Lauren Harris. Lauren, the screen is yours.
All right. Thanks, Rondian. Appreciate it. Let me get going here with my presentation. Okay. So today I want to talk to you about how to develop from manager into leader. And we're going to talk a little bit about the following concepts. We want to understand the differences between managing and leading. We want to identify when each skill set is needed and how to pivot between them, and learn how to assess your own effectiveness as a leader. So first of all, I want to say you're all leaders just by showing up today. It's an incredible thing to take time for yourself and for your own professional development. And I know sometimes it can feel overwhelming with all of the tasks and things we need to get done every day. So I give you kudos and commend you for being here today and taking the time. Well, let's jump in. So the first concept is the differences between managing and leading. And I love this quote from Simon Sinek. If you're not familiar with him, take the opportunity to look him up and some of the books that he's written and follow his blog. But he says, leadership is a way of thinking, a way of acting, and most importantly, a way of communicating. And that really resonated with me, and we'll talk a bit more about why that is in a second. So when you think about the word manager, there are some specific things that come to mind. So a manager is critical to business. They provide all of the tools and the training for employees to make sure that they're not only productive, but successful in their roles. They also ensure that all the infrastructure is in place and available at the hands of the employees so that the organization can be successful. And a manager, of course, has direct reports in a position of authority within the company. They monitor and track progress and focus on systems and structures. We think about that word manager, those are the things that come to mind. And I loved this comparison too. So when you look at managing versus leading, the manager is on the left-hand side, leaders are on the right-hand side. And I'm not giving judgment to either role. I want to know, or I want you to understand what you take away today, that both are extremely important skill sets to have and to develop. And we'll talk a little bit more about why as we go on. But this list was available from the American Academy of Pediatrics, and it really resonated with me. I'll give you a moment to read that. If you have any thoughts or questions, you can jump in the chat, and Rondianne will read them to me. Or you can jump off mute if you want to. All right.
No questions.
Hearing none, we'll go on. Okay, so let's get more specific. So management tasks, or the tasks of a manager, things like time cards and building schedules and recruiting and hiring staff and the accounts payable process, billing and coding, training others in job skills. Those are all things that fall under the category of management. When we think about leadership tasks, those are things that are like mentoring, coaching others, developing strategy, communicating vision, and relationship building. So much of leadership is about relationship and communication. So you can see that these are both really important, but they're different. So leaders focus on motivating people, while managers focus on tasks, systems, and structures. And again, you have to do a bit of both in your role. Where leaders seek to challenge the current state, managers try to maintain the status quo. And that's because change can be really difficult if you're trying to manage people and processes. Leadership, on the other hand, looks for opportunities to change that current state and to progress. Leaders seek to be innovative, and managers look to copy. So they want to know what's worked in the past, what's working with other folks who do our roles. And both, again, are valuable, but they're different skill sets and to be used in different ways. So leaders take a long-range perspective. That's what I mean about setting vision. And managers can take a shorter-term view. So thinking about the tasks again, are we getting those things done that we need to get done in a timely manner to effectively manage the practice? Leaders use emotional intelligence, and managers are more concerned with intellect. Leaders explore opportunities, and managers avoid risk. Again, because the status quo is safe, we know what to expect. Where leaders actually look for things that are a little bit unsafe, and how can we think outside the box and push our teams in a way. Leaders inspire trust, and managers rely on control. So a lot of times, if you've worked for a bad manager, you know what this looks like. They're the kind of leader, or manager rather, who will say to you, this is what I need from you because I said so, or because that's the policy, as opposed to a leader who will give you the greater vision and help you understand the why behind the decisions that are made and the things that need to occur. So before we move on to concept 2, I want to pause for just a minute, because some of the things I shared in there might feel a little bit controversial. You might disagree, and that's okay. I want to just take a moment to say, let's chat about that. Did anything in there feel uncomfortable or scritchy, or do you disagree? You can chat or unmute either way. Has anyone worked for a manager in a leadership position? In other words, have you wished that someone that you reported to or that you worked with on a team behaved more like a leader, and instead they behaved more like a manager? No one's experienced that? I bet you have, and you just don't want to share that story. Oh, Chelsea says definitely. Oh, good. Thanks for being brave, Chelsea. Yeah, and Jennifer too. I think we all have. Every position until the one I'm in. Okay, great. Now we're getting some dialogue going. Thank you. Yeah, and so what I was hoping for you to get out of today was to be able to distinguish in your own mind what the differences are, and how you want to show up in your own roles, and how you want your team to perceive you. And one of my favorite leadership speakers, Joe Mull, he talks about how Whether we like it or not, because we manage and lead teams, we are the subject of someone else's dinner conversation. Let that sink in for a moment. When your employees go home and they're talking to their families about their work life, you're probably one of the topics. And so think about how you want to be perceived and how the work that you do affects your teams, and when you need to execute management style and when you need to execute leadership style. So that's going to be into our next concept here, which is identifying when each skill set is needed and how do you use them and how do you pivot between the two. So really the mindset of a manager is different than a leader. And I loved this example. Managers have a bricklayer mindset and leaders have an architect mindset. So again, the bricklayer is the one that's down there in the weeds, doing the work and building things structurally, but the architect is the one that's setting the vision and really creating where the organization is going to go. And managers can use their ability to implement those structure and processes and standards and still transfer those skills to work with their team to build vision and share direction. But managers who want to be more like leaders need to take their eye off the bottom line and focus on the horizon. So I know it can be hard to do both because sometimes you're stuck doing payroll and AP and those really logistical, technical management things. But I'm encouraging you to think about the daily tasks that you do and the opportunities that you have to show up in more of a leadership role. So another difference is inspiration. So a manager plans details and a leader sets the direction and inspires others to follow. So a manager is going to tell you exactly how to do something, while a leader is going to say, this is where we're headed, and I'd like you to participate in the process and the development steps of how we're going to get there. So the goal here is really to make a shift from transactional interactions into transformational ones. I'll pause for a moment in case there's any questions.
You want to talk about it later? Or? Yeah, I can.
And let's talk about leveraging talent. So a manager will delegate tasks to individuals, and a leader will create teams of people whose strengths and weaknesses balance each other that reach peak performance. And you can often exceed the end goal by creating these high-powered teams. Leaders learn to identify and relate to a wide variety of personalities and talents. They build relationships, there's that word again, that are mutually beneficial and rewarding. So the next time you need to get help with something or create a process for something, instead of thinking about delegating that individual task, think about, is this an opportunity for me to build a team who can solve this problem for us or create this solution? Is this an opportunity when I can help someone else grow into that role without specifically delegating to them the steps that need to be done? And that comes to trusting the team. So a leader will give the team direction and trust everyone can handle the task at hand without micromanaging. But this is the trick. You also have to remain available to help when needed because you don't want the team to feel abandoned. So there is this delicate balance when a great leader can trust the team and inspire them to exceed expectations, but only stepping up when needed. So again, the leadership part of you is going to set the direction and really empower the team around you to help achieve that end goal, but without giving very specific rules and responsibilities for each person. So now I want to take a moment and have you type in the chat some words, descriptions about the best leader that you ever had. What key words come to mind? You can just pop them into the chat as they come up in your mind. The best leader, supportive, great. Consistent, dependable, yeah. Oh, there was a long list, went by fast. I'm gonna have Rondianne read that one back. Creative, motivating.
Empathetic, motivating, compassionate, supporting, willing to help. Awesome.
Yeah, yeah.
Supportive and communicates. Appreciative, adaptable, team member,
Open-minded.
mentoring.
All great. You've had some good leaders in your past. I'm glad to hear that.
Mhm.
A good listener. Yeah. Some of the other words that I've heard in the past: collaborative, coach, visionary, compassionate, knowledgeable, committed, encourage, Karen says. Yeah. Passionate, relational, team builder. So what do you think? Are these traits and words that you've listed, are they innate or are they learned? Anybody want to take a stab at that? Both, yeah. I agree with you, Leslie. I think it's both. I think some people sort of have that natural leadership quality. We think of that, are we bossy or are we good leaders? And also, I think this is something that you can fine tune, something that you can focus on and develop your own skill set. And we're going to talk a bit more about that as we go on. But I think what's key here is looking at how much of these words have to do with relating to people and building those deep relationships and getting to know the individuals that you work with in order to most effectively lead them. You can manage anyone. You can tell someone exactly what to do, when to do it, and how to do it. But being the type of leader that people want to follow, that's a different skill set. Anybody disagree with that? Super. I love this quote. She says, your role as a leader is to bring out the best in others, even when they know more than you. That's from Dr. Wanda Wallace. And I found this on a blog called Leadership First that you might want to follow. But I want to add my 2 cents to this and say, especially when they know more than you. So the key is hire people who know more than you and get out of the way. Let them do their jobs effectively. Don't try to tell people exactly how to accomplish the goals, but let them make the space to do this on their own. I love that. So concept number 3 is how to assess your own effectiveness as a leader. And this is a really great combination here of words that I've found from the Exceptional Leaders Lab. And these are 10 things you must give up when you become a leader. So first of all, the need to always be right. When you're a leader, you're in the recognition business. You need to let everyone else be right and step out of the way. If you've ever worked with a leader who always had to be right and never gave space for anyone else's input or to be part of the process, that can be extremely demoralizing, and actually something we'll talk about in our next session, which is on employee engagement and team building. But as a leader, your goal is not to be right, but to recognize others who are right and others who have things to bring to the table. Gossip. Oh my gosh. If you've ever been in an organization where leadership has this bad habit of creating or spreading gossip, it is absolutely detrimental to the organization. And you have to give it up when you're the leader, both as the instigator and as a recipient. So if someone comes to you with gossip, you have to say, that's not what we do here. And that comes back to the values of the organization that we talked a little bit about last time. That can be a core value, that you don't share gossip, that you stop it when you see it occurring. And this is a tough one, but when you're a leader, you don't get frequent praise. And even if you want it, and even if you need it, it's really hard to get. So I think this is one of the most challenging things, is that your work and the results that you deliver, sometimes they have to just speak for themselves. And you have to find ways to look at your own work at the end of the day and know what you've accomplished. Because when you're in that leadership role, oftentimes you're one of a kind. You're not a medical assistant on the clinical team. You're not a physician on the clinical provider team. You're usually in management or a single one person, right? So there aren't a lot of opportunities where you're going to hear that praise. that's kind of what this space is for. I was hoping that we would all sort of get to know each other a little bit too and be able to have a peer group after this series where you could reach out to one another and say, hey, I'm having a bad day, or I'm curious how you would handle this situation. And that then we could become a support network for one another, because it's very important that we have that. Distractions, gosh, it's all about distractions right now, isn't it? Focus is the new IQ. And if you are able to maintain focus, and I'm going to add remain organized, that is going to absolutely increase both your management and your leadership skill. So designating a time and a space for you to focus on specific things and also your own professional development is absolutely key to being a good leader. You also have to give up labels and biases when you're a leader, and that's hard. Stereotypes and biases can be really risky judgment inhibitors. I love that she said that. So when we think a lot about now diversity and inclusion, how we try to build a more diverse workforce, we try to have workforces that reflect the communities that we serve. It's really important that we're conscious of our own unconscious biases and the things that come up for us when we're hiring or when we're taking care of the teams that report to us. Excuses. Oh, wow. So leaders are in the performance business, and excuses are accountability leaks. In other words, you know, the buck stops with you. When you're the leader, you have to be able to explain and stand by your decisions. And sometimes that means saying that you're wrong or that you made a poor decision. But I think accountability is just as important in leadership as being the key decision maker. So think about that and how that relates to the work that you do every day. And the fear of change, more than ever before. Oh my gosh, we have to be the leaders around change now. Think about how far we've come in, what, 11 months now, almost a year or close to a year from the time with the first COVID cases in our area. And we were just talking about telehealth. If we look back at how reluctant many of our clinicians and patients were to adopt the telehealth concept, and then look at that, we did it. We made it happen. And it's become part of the regular workflow for many of us. And I know some of that reluctance was around reimbursement and you know, policies that have changed to make it easier. But there's also sort of a fear of change that's out there. And as leaders, we have to be the ones to make it safe and be brave and set goals that are stretching our organizations. Any thoughts on those 7 things we have to give up as leaders? Is there one that resonated with any one of you? No favorites? They're all great. Yeah, I love these. Thanks, Chelsea. They are. And part of being a leader is being able to self-reflect. And taking a hard look at ourselves sometimes can be a little uncomfortable. This is a great place to start and say, do I have any of these bad habits? Is this a chance for me to think about eliminating some of these things? All right. Tamara says accountability and admitting, oh, it went away fast. Help me out, Rhonda.
Accountability and admitting mistakes, strengths, areas of opportunity.
Yeah. We've all worked for leaders who couldn't admit when they made a mistake or a bad decision, and their credibility just goes out the window, doesn't it? It makes it really hard to want to follow their vision if they don't stand by decisions that they make. And I like this concept too, that good leaders are selective and conversational about initiating change. So when you think about all of the change that we're going through now and have been through, ask yourself some of these questions. Do you focus first on people and gathering input? Or do you come to your team and say, we need to change this process and this is how we're going to do it. This is the 10 steps. This is the pieces that we're going to create and start tomorrow. That's management. Focusing first on people and gathering input is leadership. And sometimes we have to do both. Sometimes we need to start with the people part and then move on to the policy part. And that's okay too, because then people feel a sense of buy-in to what you're asking them to do because you've asked for their input and you focus on what's important to them. Again, do you announce change or discuss it? Is this the policy and how we're doing it tomorrow? Or do you talk about it with your team first and get their input? And do you take time to build relationships and trust? So if you think about it, if you go to your people and you ask them for input on a particular topic, if they don't have a relationship with you where they feel that they can trust you, they're going to be very quiet. They're going to be afraid. They're going to say, no, we don't have anything to share, when you know that they do. You know that they're the ones doing the work. And I encourage you to, if you take nothing else out of today's conversation, to take the opportunity to develop deeper relationships with your teams and start to create trust. And that can look like just getting them used to you being around. So instead of making them come to you when they have questions, which is often called the open door policy, I heard this in a podcast recently and it really resonated with me. Instead of saying I have an open door policy, which invites people to come to you, have a go and see policy. You are on the floor. You are paying attention. You are spending time with the people doing the work. And while at first that can be a little awkward if you've never done that, and people can get a little worried, why are you here? What are you watching? Are you grading me? And am I, going to be given a quiz at some point? After they know that this is the norm and that you're doing this in order to engage them and give opportunity for them to give feedback. Chelsea says she loves that and her manager does it. Great. You learn that those relationships will give you so much more information over time than if you just every once in a while stop and ask the team for input. So make it a habit. Some people call it rounding. Make it a habit to be seen. And again, don't just think of it as having an open door policy where people come to you. Make sure that you are, as they say in Lean, going to the Gemba or going to the workplace, going to visit where things are done and meeting with people and learning more about them. Any more thoughts on this particular slide?
Lauren?
Yeah.
This is Rondianne. When I was a director of clinic services at Grand Island Hospital, I just felt like I wanted to do that, but I didn't have the time. I was so incredibly busy. So, I can empathize with how busy managers, directors, leaders are. And so what I decided to do was I would take my team to every OMGMA conference, and we'd get to know each other driving down there, driving back. It just, we created just the greatest relationships, and just, those maybe once or twice a year, if that. But I cannot believe how much it helped. So
yeah, you made two really good points there that I want to kind of focus on for a minute. One is taking time outside of work and getting to know your employees as people. Oh my goodness. We have for the longest time in our communities thought of this sort of hierarchy of staff and management, staff and leaders. And, I believe in good boundaries, don't get me wrong, but I also believe that there is such an opportunity to get to know what's going on with our team personally and what's happening with the kids, and especially now, are they trying to homeschool and work remotely, or, what is coming up for them right now that can help you be more supportive in the workplace? And I love that. And the other thing you mentioned was feeling like you don't have enough time, and I completely relate. As you probably heard, I've been managing clinics for about 25 years, so I know the walk, and I still do the walk on an interim basis regularly. At one point, I had 60 direct reports. And there was no way I was going to visit with 60 people, daily. That just couldn't happen. So, and this is going to sound a little silly, but I did a little bit of reflection and I noticed that there were certain people that I avoided. And this is me being vulnerable with you. I'm sure you probably felt this way before too, where certain people, when you drop by their desk, they're either giant time sucks and you can't get away, or all they want to do is tell you 15 problems and you end up feeling really depressed when you visit with them. So I had naturally avoided some of those more challenging relationships. I made myself a spreadsheet And I held myself accountable to meeting with those people on a regular basis, even the ones that were uncomfortable at times. So if you have an extremely large team, or even if you don't, create that sort of accountability for yourself, that you are either creating these regular one-on-one check-ins with your staff, or even just the drive-by, drop-by, visit the department sort of opportunities. Because we naturally will avoid conflict, many of us, and it has to be something that's very intentional. And I love the idea too of setting a regular time on your calendar, making it rounding Monday or whatever it is, and blocking that time in your schedule and making it sacred so that there's no other meetings that can go there. There's no other opportunities to be distracted, but that is the time that you focus on leadership skills and not management skills. And I know I missed something in the chat, so please share.
Okay, let's see. Excellent point. Such a change of attitude when leaders do this versus when they don't. Our CEO actually does this as well. It's a regular part of his day. He rounds the entire hospital and addresses everyone by name, asking how they are, details about their weekend, etc. I talk to him every day. It's a unique concept to me, but it really connects us with upper management. That is awesome.
Yeah, good for him. That's amazing. And what I love most about that is that he knows a thing or two about people. He's not just going and being seen and, being the big guy in the suit, so to speak. He's actually connecting with people. And that's what it's about. It's about building those relationships while you're doing that rounding. That's so cool. Lucky you.
Jennifer also says, I think I missed this one. I always tell my teams that they are the experts, so I need their help to move things forward, which is so perfect.
Yes, absolutely. I mean, I don't check in patients every day. I don't answer the phone every day. I'm not rooming patients like the medical assistants. I need their expertise. Absolutely. That's a really good point. One more just popped up.
Okay. I had done a short stint at an organization when I was an intern, then 4 years later applied for a position. The CEO remembered me by name. That is such a unique experience from previous positions. That's true.
Wow. That's phenomenal. That's really cool. And that person made such an impact on you personally, it sounds like, too. And it's someone that you'd want to follow. You can really respect someone like that. Did the concept of making a spreadsheet and holding yourself accountable resonate with anybody else, or is that just me?
I loved it. I thought it was a great idea.
Yeah, it's just natural that we tend to get in habits where we go visit the people that make us feel good, and it can be hard to remember to go visit the ones that maybe don't make us feel great every day, especially if you have a larger team.
Jennifer says, I have my one-on-ones scheduled on my calendar to keep me accountable.
Yeah, that's fantastic. And I hope those are pretty immovable. I mean, weather, excluded, but that's awesome. Great. All right. So here are some tips if you've recently been promoted from a peer to manager leader. And sometimes this happens, well, frequently this happens. We will identify people who are really great at their jobs. You might be noticing that this person's a tremendous patient service rep or tremendous medical assistant. And so you want to make them the lead PSR, the lead MA. But do we really do a good job of coaching them and what that looks like? And so I wanted you to think about this if you're in this position, or if you're a leader for someone that you've recently promoted from peer to manager and leader. The key with this is to, again, start with transparency, vulnerability, and relationships by preparing yourself and the team and being open and talking about things and talk about what needs to change So this is a tough one sometimes, but talking about setting boundaries. You know, for example, social interactions outside of work may have to change, and connections via social media may have to change. And this is kind of a controversial one about whether or not we friend our staff on Facebook, that kind of thing. So I won't dive too deeply into that water, but I know a lot of managers and leaders feel that that's inappropriate or that that is difficult for them. And so if you're suddenly moving from that peer role where your best friend is then sitting right next to you and you're on Facebook and you're spending time together outside of work, it may be important to have that conversation to say, you know, that's not going to work anymore. Doesn't mean I don't like you as a person. It means that we need to set some appropriate professional boundaries. And also talking about what would stay the same. So giving input, we still want to hear from each other. Sharing your expertise, you were promoted because you were an expert in that role. So that doesn't go away. The communication with the team, you know, maintaining those relationships is all going to stay the same. And I like this idea too of keeping some of the work, if you can, while you adjust to the new role, or helping this happen if you supervise someone who just changed roles. Can they continue to be an MA with a provider for some of their work and learn these leadership and management skills at the same time so that they're stretching in a more gentle way instead of all of a sudden one day you're no longer the medical assistant. Now you're suddenly the lead and all of your tasks and roles have changed dramatically. Has anybody on the call moved from peer to manager leader or recently or even in the past and experienced some of these challenges? Not within the same organization. Yeah. Oh, Nancy says, yep, it was hard. Yeah. I'm not, but hope to. Awesome. We'll keep these in mind. Okay. Yeah. It can be a really hard transition. And if we lead others, it's something that we should talk about with them in our one-on-ones, like Jennifer said, of how can we support them in making this shift and being, again, really clear with what's expected and what's going to change and what's not going to change is really key. So instead of just letting things happen, being intentional about it. Oh, I saw another one pop up. Can you read that one, Rondianne? They only stay with me for a second and then they go away.
Yes. I have progressed to the clinic supervisor from the lead MA. I keep open communication with the current lead MA.
Awesome. Good for you. Yeah. So your scope and your role changed, but your team didn't. And so have you had the opportunity to talk to folks on your team about what's different and what's staying the same? And you can take yourself off mute too if you want to, if you're brave enough. Well,
Hi everyone,
this is a big.
I was just
Go
going to
ahead.
say, just to orient people, the mute button's lower left in WebEx, in just the bottom lower left of the middle left of
Thank you.
the window. You could also go walkie-talkie mode and just hold your space bar down, and while you have it depressed, your microphone is live. When you release the button, the microphone goes muted.
Oh, I'm amazed. That's super cool. I didn't know that. Thanks, Eric. Appreciate that. So how do you know when you're leading or managing? Asking others and taking time to reflect. So I mentioned this earlier, but 360-degree feedback, as uncomfortable as it can be sometimes, is so important. So taking the time to ask people how they're perceiving the work that you're doing, and then making time on your calendar to reflect on that. So just like you're making time on your calendar to round with your staff and get to know them personally, I highly recommend that you block some time on your calendar for yourself, for your own professional development. So something like this counts, but also just 30 minutes to stop and think, stop and meditate on your own performance. maybe on a Friday afternoon, or maybe on a Monday morning, you stop and you think how you want to show up this next week and what worked well for you last week. But I think we get so busy with the day-to-day tasks and the management things that we need to do, we often forget to take a moment and think about how we want to treat our teams and take care of our tasks in a very intentional way. So I know I missed a comment, but I also want to ask, does anybody have a time to reflect on their calendars yet? Or a specific meeting with yourself that you don't move, that's a sacred time? No. Cool idea though, isn't it? Make a one-on-one with yourself and actually sit down and think about some of these things and how are you doing with these different tasks that we're talking about in these different leadership skills. So what did I miss in the chat?
Karen said, I enjoyed the lead MA and I tell everyone I'm their cheerleader. I have a hard time letting go of that mindset.
That can be tricky. Well, I love this quote as well. And you're going to see in these slides over the next few weeks that we do together, a lot of quotes from Tracy Spears, who is not only an amazing author, speaker, she is a friend and somebody that I just adore. She says in one of her books called The Exceptional Leader's Playbook, the most impactful thing you can do to improve as a leader is to work directly on your own skills and understanding of leadership. It's not working on the people on your team, not tracking goals and targets, not prioritizing and optimizing. It is working on your own skills as an influencer and leader. Wow. All that other stuff's important, but really the most impactful thing that you can do is develop yourself and work on yourself and reflect on yourself and make that appointment with yourself so that you're checking in. So here's some symptoms of a failure to lead. And as we think about self-reflection, these are some things to ask yourself. And I know we can often see these in others, and so we can definitely take a moment and think about them in ourselves. Is there a lack of alignment with a clear and shared vision? Do you sometimes pretend to know it all? Are you afraid to change the status quo? Are you not having the right conversation? Oh, that one's heavy. Is there an absence of trust? One of the symptoms that I can see in this case is when the manager or the leader walks through a workspace and things suddenly get quiet. That means you don't have the relationships and you don't have the trust of your team. You want them to not be afraid when you show up. You want them to feel that they can have candid conversation with you and that they trust you and you trust them. Are there complaints that you're hearing about third hand, but people won't actually come and tell you when something's wrong? Sometimes people are consistently late, and this is a hard one. But, you know, this really demonstrates to a lot of people, including me, I think a lack of commitment and a lack of prioritization. If you're not showing up to meetings on time, if you're not delivering performance reviews on time, if you're not keeping your one-on-one appointments that you said you're going to keep, that really sends a message to people that they're not valued in the same way as the rest of your life. It might sting a little for one or two people. And a lack of accountability. Wow. If you're always blaming someone else or something else instead of saying, you know, that was my decision and I wouldn't do it the same way next time, and here's why, that's a big symptom of a failure to lead. Oh, this is a hard one. You can't please everyone. And sometimes it can be really destructive to try. You can lose track of your vision and the bigger picture by trying to make every single person happy. All right. So I attend a lot of webinars because I like to learn stuff and I like to pass it on and things like this. And one of the things that I am really careful of is I want to have a takeaway. I want to have something that I got out of that session. So I'm using this new symbol here to let you know, here's a takeaway. Hopefully it's something that will make sense for you. So how can I learn to improve my leadership skills? Here's some podcasts, and you might have other ones. I'd love to hear about them in the chat if you do. Boss Better Now is a new one that Joe Mull has put out. I think there's 6 or 7 episodes. These are all available through all the normal podcast channels. Leslie likes him. I think he's just amazing. I would be Joe Mull when I grow up, except that he's quite a bit younger than I am. But he has an amazing podcast, and it's so relatable. He has a leadership coach that he sort of does the radio show with in the podcast. It's very reasonable length of time too. It's 30 to 45 minutes. So sometimes you can do that on a commute or just on your time on the treadmill or whatever it is. Check that one out. Real Life Leadership by Tracy Spears. That's the quote I read you earlier. She's one of my favorites. She has some really great sessions. The HBR Idea Cast, which is the Harvard Business Review. They have a lot of great stuff. And Work Life from Adam Grant. Anybody want to throw another favorite in the podcast or in the chat rather, or the podcast in the chat? How about books? Some people are book readers. I think this one is amazing. So there's a woman named Lolly Daskell that I discovered, funny enough, on Twitter. Somebody else, another leadership person that I follow, retweeted something that she said, and she regularly tweets segments of her book or quotes from her book, and they are genius. They're just amazing. And as we go on in this series, you'll see some more things that I'll share from her. Crucial Conversations. Hopefully some of you have heard of this process. This is some amazing stuff. Crucial Conversations. There's also Crucial Confrontations. There's also a book called The Influencer. These folks do some amazing training videos as well. If you don't read the book and you don't take the class, you should definitely sign up for the blog and get those regular emails. I learned so much from these folks, and it's so practical. Does anyone else love these guys as much as I do? If not, maybe this is new, but all of these have blogs too, where they'll regularly send you information and updates. Yeah, the course series is awesome. If you can take the Crucial Conversations training series, I highly recommend it. Sometimes hospital systems will have people come, or they'll have trainers on their site that'll do that. Oh, Jennifer took the training too. Yeah, good stuff. Drive by Daniel Pink. He has a book called The Surprising Truth About What Motivates Us. That's been a great recommendation as well. This one I haven't read personally, but I've heard several people recommend it. Can anyone else speak to this one? Patients Come Second, Leading Change by Changing the Way You Lead. It's on my list, but I haven't gotten there yet. Okay, well, we're all going to add it to our reading list for this year then. And this one was interesting too. Dyad Leadership in Healthcare, when 1 + 1 is greater than 2. So a lot of you I know have dyad relationships with your medical director or with a clinician. And there is so much that can be done by leveraging your administrative skills and their clinical skills and experience in creating highly performing teams. So I'd really like to share that one with you. Any other favorite books you want to post about in the chat? I have one more, I think. Yeah. Of course, yeah, Brene Brown, Dare to Lead. Thank you. How did I forget that one? She has an amazing podcast too. Although I found her sessions to be longer, and so if you're going to do those while you exercise, just be prepared. They're longer sessions. You're now committed to an hour instead of 45 minutes. Has anybody else read this one, How to Say Anything to Anyone by Shari Harley? Or seen her? Not yet? Okay. Well, check her stuff out. She has some hysterical YouTube videos. She has little snippets that she's recorded. Things like how to tell someone that they smell. How to tell someone that they need to cover their cleavage. I mean, just practical stuff. And she does it in such a way that I think is so real. And the basic concept here comes back to relationships again. Her idea is that when you have relationship and trust and clear expectations with the people that you work with, it's so much easier to hold them accountable for things. So I highly recommend that one too. Online training. So here's some ideas too. So in addition to what we're doing today, here's some of my favorites. So Tracy Spears Exceptional Leaders Lab, she has this leadership playbook course that's only $49, and it is amazing. Highly recommend it. It's a self-paced, multi-module training course. You just go to the website and you go through each of the sessions at your own pace. Vicki Hess is another coach that I follow. She has a bunch of really cool leadership resources and tools on her website. And then, is anyone else familiar with the Steps Forward program from the AMA? If not, bookmark that one. So I added that one at the end here. They definitely have some pieces that are leadership focused, but they have a lot focused on all kinds of practice transformation concepts. So how to create highly effective patient-centered medical homes, how to create high-performing clinical teams. There's some brilliant stuff here that I think everyone should watch, pay attention to. Well, sorry, Jennifer, we'll see you later. Hopefully there's one here that resonates with you. All right, and then I know Rondianne spoke a little bit in the beginning about the one-on-one coaching, but that's something that I do where I meet with folks and provide personalized advice, planning, and feedback. And also, when you have a coach, you're creating accountability for yourself. You're setting up goals with that coach that then they're going to ask you about. And that sounds a little scary, but it definitely creates results and can actually move you forward. And this also creates a dedicated time and space for you to be working on you. So to come back to what Rondianne said, there is usually a fee for this, but there is the potential for a scholarship, I believe, that you might qualify for. So if you're interested in working with me one-on-one, please reach out to Rondianne and she can put you in touch with me and get the information that's needed. There's also a lot of other coaches out there. So if you're not feeling like I'm someone you can talk to, and that's totally okay, find someone else and actually create this time and space for yourself. It will help you grow tremendously. So some more takeaways here. If we can learn to speak the vocabulary of leadership and use the right words, we not only motivate people, but we inspire them to be successful. So these are some of my favorites. If we use language like, go for it, it shows that we want the team to be creative and to be brave and to maybe think outside the box and try something new. How about, what do you think? Or what do you think? You can look at that either way. Being able to use those words and feel comfortable with getting that feedback from your team can help them be higher performers. I love this one. I trust you. Wow. Don't we all want somebody to say that to us? What if our leaders actually said that to us on a regular basis? I trust you. I know you've got this. Let's try it. There's a concept called tri-storming, which is basically brainstorming in action. So when you're meeting with your team and you're thinking about ways to solve a problem, set up a tri-storming session, set up a PDSA cycle, a plan, do, study, act cycle, where you're actually going to try a new workflow or try something different for a set period of time, and then go back and look at it and see what the results are. This is a good one too. We've all worked for leaders that are secretive or organizations that are secretive, and they don't tell us what's going on. And what happens then? Everybody makes up their own story. So be as clear and transparent as you can be with your teams and share what's going on with them. This one is so meaningful. And I think we in healthcare do a terrible job at this. We don't celebrate successes or remember things the way that we should. So I'm encouraging you today, again, nugget right here. Write something down when it's gone well. Celebrate it. Bring it back to your staff meetings a couple months later. Hey, remember when we did that thing and it went so well? Look at how happy our patients are. Look at how much better the workflow is. Remember to document and celebrate those successes. This is a big one. Again, being brave and vulnerable. Brene Brown talks about this a lot, but being willing and able to say when something didn't go right and it was because of a mistake that you made, it's okay to make mistakes. The key is, did you learn from it and would you do something different next time? And as I interview a lot of senior leaders for administrator type roles or clinic manager roles, one of my favorite questions is, tell me about the biggest mistake that you've made at work. And I don't care what it is. I want to hear, what did they learn? What would they do differently? And are they comfortable acknowledging that they made a mistake? That's a big deal. And it shows a really high sign of emotional maturity to be able to do that. So one of the other things that I like to coach people on is making sure that we say thank you frequently. And this can be a simple handwritten note. It can be an email. It can be a sticky. It can be just walking by. And encouraging your physician leaders to do this too, because oftentimes clinical teams don't get enough recognition from the clinicians that they work with. So here's just 10 samples of ways to say thank you. And here's Lolly Daskell again. You can go to that link and she has 100 ways to express love as a leader. And these are all so good. Does anyone have a favorite here? You can just pop a number in the chat if you like one of these in particular. Number 2, awesome. Yeah, number 1, so simple, I appreciate you. Yeah, we are better because of you. That one resonates with me too. Auntie's great. All right, so coming up on the end here, but basically, I wanted you to think about this for a moment. And here's a little bit more information about how to get in contact with me. And I wanted to mention that our next workshop is Thursday, February 25th from 12 to 1. And we're going to be talking specifically about employee engagement and team building. So I hope you found this valuable. Again, my heart for you is that you got something that you could take away and implement and make real and make live in your leadership life, and that you learned something new today. So any last thoughts or feedback before we wrap up? Or Rondianne, do you want to do the last comments? Oh, wow, perfect time again, 12:57.
Thank you, Lauren. I think this is just awesome, especially because leaders often don't take time for themselves. And so I think these webinars and these workshop sessions are just such a benefit. I hope that more of the RH leaders can participate. So thank you.
Thank you for the opportunity.
And also, as a reminder, make sure that everyone completes the survey, and we will see you at the next workshop session. Thank you, Lauren.
Thank you. Oh, there was a quick question about where to find the recording. Can you remind everybody?
Yes, it will be on the Office of Rural Health website, and it will be under Rural Health Clinics, and there is a subtitle Webinars 2021, and all the webinars are listed there in order depending on if it was 2020 or 2021.
Super. And I know I sent you the slides. Someone else was asking if they're available. Will they be posted there as well?
Yeah, the slides.
Perfect.
And I will send out the slides, and I will send out the webinar. Some people want it and some people don't, but I'll go ahead and send it out for them.
Sure.
As soon as Eric gets it all wrapped up in a nice little package.
Awesome. Thank you both. And I appreciate the opportunity to talk with everybody today. I hope you found this to be sort of grounding and affirming, and I look forward to our next session in 2 weeks. Everybody stay safe and warm out there. Take care.
Thank you, everyone.
Thank you.